اليوم we are having very good presentation is talking about KPI Roadmap. اليوم عندنا presentation موعودين فيها بانطلاق في رحلة لمؤشرات الأداء. الرحلة هذه تقودها الدكتورة رنا المنديل رئيسة شؤون الجودة في التجمع الصحي الأول بالمنطقة الشرقية. تعرض لنا تطبيق عملي عن أسس اختيار وتطبيق مؤشرات الأداء وبعض الأمثلة الحية من مستشفيات التجمع مع تطبيق مؤشرات الأداء وانعكاسها على أرض الواقع. سيخرج طبعا المستمع بفكرة عن كيفية استخدام وتطوير مؤشرات الأداء لدعم احتياجات القادة في مؤسستك. دكتورة رنا خير من يقود هذه الرحلة وخير من نتعلم منه. المايك معك دكتورة رنا، تفضل.
بسم الله الرحمن الرحيم، حياكم الله جميعا. شكرا اخوي عبد اللطيف على المقدمه. يعني انا افخر اني اكون جزء من المنظومه واني اقدم ولو القليل ان شاء الله اليوم في هذه المحاضره علشان الكل يستفيد باذن الله. احب احيي جميع الحاضرين من جميع مناطق المملكه، وكما سمعنا انه حتى عندنا حاضرين معنا من ايرلندا، فنرحب جميعا بالحضور. وراح أتكلم بالإنجليزي والعربي عشان بس أتأكد إنه الجميع ممكن يستفيد، لأني أعرف إنه في there are some non-Arabic speakers, so I will try to speak in Arabic and English in this presentation so that I ensure that everybody can understand. I'd like to start by welcoming you all from all areas of our beloved kingdom, and I understand that we also have some participants from Europe and Ireland. So welcome everybody. And in this presentation, I will go through the journey of KPIs and how we can select healthy KPIs that can help us in our organizations and ensure that we are measuring the right thing and doing the right process. My name is Dr. Rana Al-Mandil. I'm Chief of Quality in the Eastern Region Cluster, or E1 for short. And I will start. The way that I like to think about the KPI roadmap or the KPI journey is like a train that's moving on certain tracks. هي عبارة عن محطات، ومسيرة ال KPI تمر في عدة محطات، وأنا راح أوقف في كل محطة وراح أتكلم عنها بشكل أوضح. فبسم الله الرحمن الرحيم. We will start with, as you can see in front of you, a roadmap, or what I'd like to call the journey of the KPI. KPI journey is like a train that moves on different tracks, and I'm going to stop on each of these tracks and talk about them in more detail. The first track, and in my opinion, the most important track, is the KPI selection. When we think about KPI selection, it's important to think about this very simple acronym, SMART. SMART is an acronym that stands for specific. The KPI that we select has to be specific, has to measure in particular the area of the process that we are interested in. It also has to be measurable. For example, we know that there are some quantitative ways to look at KPIs and qualitative ways to look. Usually, quantitative methods are easier to measure than qualitative. So think about the KPI and how measurable it is when you're in the beginning of your journey. Also, KPIs must be actionable. And what I mean by that there are some KPIs ممكن يكونوا specific, ممكن يكونوا measurable, but they're not actionable. I'll give you an example. If we look at measuring the public awareness on childhood vaccination, or the public view on childhood vaccination. That is a very general KPI and we can measure it, but it's very hard to action it. Why? Because it's extremely wide. Public perception, for example, is an example of a KPI that you can measure, but it's very difficult to action. KPIs also have to be relevant to the process that we are studying and the process that we're interested in. And finally, that have to be time-based, meaning that they have to be measured in units of time, whether it's minutes, hours, days, months, and so on. Also, something very important to look at is the type of KPIs. We all know that we have clinical types of KPIs and managerial. Both are important and both are very vital in the healthcare setting. And also, in the world of quality, KPIs can either be structure, process, or outcome. When it comes to priority, I'll talk about this in a little bit more detail because this is a very important area to focus on with the KPI journey. KPIs have to look at areas that are of high risk. المناطق اللي احنا نعرف إن هي عالية الخطورة. For example, patient falls. For example, medication management, high risk medication. These are all areas of high risk processes that we really should prioritize. We also, in thinking of prioritizing the KPIs, should be looking at high volume areas. Things like inpatient admissions, inpatient occupancy rates, outpatient volumes, how many outpatient visits do we see in a year? How many home healthcare visits do we do in a year? If we look at areas that are very, very low volume, we're not getting the best that we can out of the KPIs. So high volume areas is also a very good area to focus your priority. It's also very important to look at problematic areas. If I know that the process is going very well, إذا أنا عارفة إنه الجزء اللي أنا بدرسه جزء ما في مشاكل أو ما في أي عوائق, then why am I measuring it? I really have to look at problem-prone areas. The area that I measure has to be aligned with my hospital strategic goals. يجب أن يتم موائمة مؤشرات الأداء مع الأهداف الاستراتيجية للمؤسسة أو للوزارة أو للمنشأة. طبعاً, the other area is accreditation requirements. The KPI that I'm looking at has to be, or it is much better if it's a part of the accreditation requirements. The biggest accreditation requirements that we are all involved in is SBAHI, for example, or the ESRs, part of SBAHI, the Essential Safety Requirements, or any other accrediting body that you're involved with in your organization. Last but not least, when looking at KPI priority, is to see if it is a Ministry of Health requirement or if it's an NTP or a National Transformation Program requirement. And a good example of that is برنامج أداء. برنامج أداء على سبيل المثال هو من منظومة وزارة الصحة وبرضه هو من المتطلبات لبرنامج التحول الوطني الخاص بوزارة الصحة. So these areas are very good areas to keep in mind when you're thinking about selecting a KPI. I'm going to give you a real life example when we're looking at KPI selection. What I will show with you now is a look at the VTE assessment. Now, the information that I will share with you is actual live information that's taken from one of the hospitals under the E1. So one of the hospitals that are part of the E1 cluster. And what we looked at in that particular hospital is improving the VTE risk assessment and prophylaxis. So what happened? We did a VTE risk assessment review in the fourth quarter of 2016. So it was a few years back. The overall compliance with the VTE assessment at the time was 42%. Very, very low. So that was our baseline. That was the standing point, or the point in which we started looking at that KPI. Our aim is to have full compliance with VTE assessment and prophylaxis. And of course, our aim is to have 100% compliance. But as we all know, reaching 100% is a journey. It can't happen in a month. It can't happen in a few months. Sometimes it takes years to happen. So let's look at this KPI in particular. It's a good KPI and a good priority selection KPI because it covers a high-risk area. Again, VTE is a high-risk area. High volume, it covers all adult inpatient admissions. So this is a huge volume for any hospital to look at. It covers a problem-prone area because the data showed that our compliance with the assessment was very low. So we know that this is a problematic area. Last but not least, it's also one of the SBAHI accreditation requirements, as we all know. Not only that, in fact, it's one of the ESR safety requirements, VTE compliance. So it's a very good example of a KPI that fits these priority selection metrics. So let's look at the data. And again, this data is taken from an actual hospital. This is real data, one of the hospitals under E1. And we're looking at two things. We're looking at the baseline. And as I said, the blue line represents patients with completed VTE risk assessment. So this is completion of the risk assessment. And the red line looks at patients who actually received VTE prophylaxis, whether it's medical prophylaxis or, as we know, mechanical prophylaxis. So whether it's either or, we're covered in patients who received that kind of prophylaxis. Again, looking at the baseline is when you start studying your process, when you start focusing on your process. Very low compliance here with the VTE assessment, 42%, which is quite low. But look at what happened, and this is typically what happens when you start focusing and measuring KPIs. There was a steady improvement and a steady increase in the compliance with the risk assessment. Let's also look at patients who received VTE prophylaxis. Again, a very nice steady improvement, quarter by quarter, with the compliance with VTE prophylaxis. What happened in this time? Again, it's not enough to just define and select your KPI and then start measuring it. A lot of activities have to take place. So what happened here is a lot of awareness, a lot of education, a lot of sharing. What we also did is that we improved the VTE assessment form, and we added the VTE assessment form as part of the history and physical so that all the physicians can see it, they can't miss it. We're gonna have a higher compliance with completion of the VTE assessment. So a lot of things have to happen here for us or for any organization to reach higher compliance rates. In the last quarter, the second quarter of 2019, we reached the upper 80s in terms of the compliance with the risk assessment and with the prophylaxis. So really good improvement from the lower 40s when we started the baseline. But again, it took 2.5 years. So sometimes with some KPIs, you have to keep in mind that the journey is a long journey. You're not looking at quick fixes all the time. Some KPIs will be able to lend themselves to quick fixes, okay? But some KPIs, especially when it comes to awareness, changing the culture, for example, assessment here is really forcing physicians to look at assessing and documenting every patient that they see. These kind of KPIs really take a long time. So you can see there's good improvement, but it's over many, many, many quarters. It's over approximately 2.5 years. Are we there yet? Did we reach our target? No, because our target should be 100% compliance with the assessment and with the prophylaxis. But we've reached a very good journey or way since our baseline assessment. There's a very good saying that says, you cannot manage what you can't see, or you cannot manage what you can't measure. So if you don't measure it, you can't manage it. And this is very true, especially in healthcare. When physicians start to see the compliance rates, they get excited. When they see that the compliance rates are going up and that the people in quality are constantly showing them these numbers, their compliance with the KPI will improve. And here, it's very important to say, as quality professionals, always go back to your leaders, go back to the physicians, to the nurses, and show them the data. You'll be surprised how much they will be interested in seeing the data. What's even more important is, again, these are actual data taken from one of the E1 hospitals, is looking at the preventable VTE rates. And of course, as we all know, VTE rates are always measured per 1,000 discharges. So we were very, very pleased to see that for 2 quarters and even the last quarters, the number of potentially preventable VTE, or the rates for potentially preventable VTE, went down to 0. We really want to keep it at 0. This is very important to share with your physicians, with your leaders, with nurses, with the whole multidisciplinary team, because once they see that their compliance makes a difference in saving patients' lives, they will be very excited to continue with their with their compliance to VTE, both assessment and prophylaxis. So sharing the data and showing the physicians the numbers, showing the leaders the numbers on a periodic basis will really help you in getting higher compliance rate. I'll give you another example. Another example that's a KPI, that's a priority KPI, is improving the OR cancellation. Okay. And again, this is an example that was taken of one of the hospitals in the E1. When they looked at OR cancellation, the top reasons for OR cancellation was the availability of a hospital bed. So the OR management were working on their improvement by changing the process of releasing the OR daily schedule. So they changed the process of releasing the OR daily schedule, and they started sending it to the case managers. The case managers were now responsible to ensure that every patient that was booked on the daily schedule had a booked bed. This is one of the ways that this hospital wanted to improve OR cancellation. Let's look at this KPI. This KPI is a very good example of a high-risk area because we're talking about patients and getting them to their OR schedules on time. High volume, it's all of your surgical population, and it's a problem-prone area because we have issues, we have cancellations, we have problematic issues with this KPI. So it's a very good example of a KPI that we should measure. I'd like to add one more thing. It's also one of the أداء KPIs. So it's also a measure of أداء, which means that it's compliance with the أداء requirements. So this is a good KPI that we know is a good priority selection area. Let's look at the performance. And again, here is real data that was taken from one of the hospitals in E1, and it shows a comparison between 2016 and 2017. The blue is 2016, and here we can see the OR cancellation percentage. It was as high as 20%. And over the months, we're seeing a gradual drop. And even more improvements in 2017, right? In the end of 2017, we saw the cancellation percentage rate drop to 9%. The latest numbers, I haven't shown them here, but it's as low as 6%. So this is an example of graphical display, clear graphical display, and ensuring that your leaders, your physicians, your OR managers, your nurses see this data on a monthly basis. Once they are engaged and they see it on a monthly basis and you have that buy-in, you will ensure that they will help you to reach good targets. So this is again a good example of how visually you represent your data and how it can help reach your goals. Moving on to the next area أو المحطة الثالثة نقدر نعتبرها KPI selection. تحديد مؤشر الأداء. هذه مرحلة جدا جدا مهمة. This is a very important stage in your KPI definition because you want to ensure that your KPI is well defined and that if you are comparing or benchmarking with other hospitals or with other regions, that you are comparing apples to apples. Each KPI should be documented using a KPI definition form. What I have in front of you is the KPI definition template that's used by the Ministry of Health. فاللي بوريكم إياه الآن هو تعريف مؤشر الأداء اللي مستخدم حالياً في وزارة الصحة. This is what's actually being used in the ministry, and it's a very great tool to ensure that your data or your KPI definition is clear and it's standardized. Let's look closely at the KPI definition. Let's break it down. What you see here is the first step in defining your KPIs, having a clear KPI name and a description. You'll be surprised. Sometimes something as simple as defining your KPI name or standardizing your KPI name, you will overlook it or think that people will naturally know it. You'll be surprised how many KPIs are good KPIs, but have a very unclear title or name. Once you have an unclear title, you lost your audience. So pay a lot of attention to the KPI name. It's very important to have a very clear KPI name. And reading it will give you a clear idea on what this KPI measures. Let's look at the next KPI. The KPI name is percentage of patients that were managed within 4 hours in the ER from door to disposition, C-task categories 1, 2, and 3. This is a great example of a very clear KPI name. I'm sure everybody in the audience understands what it is, what I'm measuring, who I'm measuring. So this is an example of a great KPI with a very clear title. Let's go and look at more information. The next step is data collection in the KPI definition journey. And this tells you what is going to be your source of data and what is going to be your numerator and denominator. إيش هو البسط وإيش هو المقام. تعريف البسط والمقام والاستثناءات مهم جدا في هذه المحطة من محطات مؤشرات الأداء. So let's look at the numerator أو البسط. It's the total number of patients that were managed within 4 hours in the ER from door to disposition for C-task categories 1, 2, and 3. Naturally, the exclusion here, الاستثناءات, will be C-task category 4 and 5. Very clear. The denominator, أو المقام, will be the total number of patients registered in the same period for C-task category 1, 2, and 3. Very clear, spelled out, with the exclusion, with the inclusion, with the formula, which is going to be the numerator, the denominator times 100. البسط على المقام نضربه في 100. والunit of measurement will be percentage. لا تستهينوا بهذه التفاصيل. التفاصيل كل ما كانت محددة ودقيقة، مفهوم العالم أو مفهوم الناس عن مؤشر الأداء بيكون جداً واضح. These elements of the KPI definition are very important and not to be missed. So you cannot skip any of them because it will give you a very clear definition. And what's more important, your audience will really understand what is the KPI that you're looking at. Let's look at the next area. The next area of the KPI definition is what we call data profiling. Data profiling simply means, how am I going to sample this KPI? What is my sampling rule? Am I going to take the full volume, or I'm going to have a sampling methodology? And if I'm going to have a sampling methodology, what is going to be my sampling size? I have to enter it. But in this particular KPI, I'm going to take the full data or the full volume of KPIs. So this is, again, very important, and this is under data profiling. In data profiling as well, you look at benchmarks and you look at targets. Again, very important, because the targets are going to show you how you're performing. Are you performing at an acceptable range, or are you in a range that needs improvement, or an unacceptable range? And based on that, you'll know how you're performing, and do you need a focused improvement, or do you need to do a focused PDCA performance improvement project to improve the performance of this KPI? So very important part is data profiling. The last part is data reporting. Data reporting tells me how often am I going to collect the data and how often am I going to report the data. Here, it shows me that the data collection is going to be monthly and the data reporting is going to be monthly. Let me give you a tip. It's often a better idea to have the data collection happen at a shorter interval than the reporting. Why? So if I'm reporting the KPI on a monthly basis or on a monthly frequency, it's always advisable to have the data collection to happen either at a daily frequency or on a weekly frequency. So always data collection should be a shorter interval than the reporting. Why? Because if I have issues, if I have challenges, if I have gaps in the data, I can catch it and I can remedy it or deal with it on a daily basis or on a weekly basis before I report the data monthly. So if you're reporting the data monthly, it's always a good idea to collect it either daily, or if that's not feasible, weekly, so that you ensure if there's any issues that you can deal with them and you can escalate them before it's too late when it comes to the monthly reporting. Now we come to the second or third station, which is data collection. Data collection, and I really want to emphasize here, it's very important. A lot of us as quality professionals sometimes think that if I don't have automated systems, if I don't have a health information system, an HIS, an ERP, an electronic database, that I can't collect data. And this cannot be farther from the truth. You can collect very good data, completely manual, completely paper-based, and not relying on automated systems. Of course, it's better and it's ideal to have automated data systems, automated data warehousing, data collection, HIS platforms. This is, who can say no to that? But what I'm trying to say here, if you don't have an HIS or if you don't have an electronic database, don't let that stop you from collecting data. Really good data can be collected manually. In fact, I can tell you from our experience, some of the best data that we had was collected manually. So don't think that if I don't have an automated system, I can't collect data. This is farther away from the truth. هنا نقطة مهمة في الداتا collection. ما أبغاكم تحبطون إذا ما كان عندكم automated system أو electronic system في المستشفى. لأنه ممكن إنك تجمع داتا وممكن إنك تعمل reports على داتا حتى لو كان كل الداتا اللي تملكها في المستشفى يدوية وما عندك any kind of information systems, you can still do it manually. You can, يعني حتى العمل اليدوي لا تكون محبط إن أنت ما عندك automated systems. Well, let me give you an example هنا بالنسبة للداتا collection. This is actually taken from the أداء system. These are the أداء collection data sheets. And again, they are completely manual. So they can be fitted on a daily basis, on a weekly basis, you name it. All you have to do is collect the data and write it into these Excel sheets, and they'll be able to collect your data. Again, daily, weekly, you name it. Manual data, there's nothing wrong with manual data, so don't think that data has to be automated. Moving on to the other station أو المحطة التالية اللي هي data validation أو التحقق من الداتا. Data validation is extremely important. Some people overlook it, but you really have to focus on it, especially in certain times or in certain areas. When should we do data validation? All the time? No. We have to do data validation in very specific times. For example, if a new measure is implemented, if this is the first time that you are going to collect this KPI, it's the first time that your organization is going to measure it, then it's a good time to embed data validation. If this data is going to be made public, if you're going to publish this data on your hospital website, on your hospital portal, on Twitter, on any social media outlet, or if you're going to print this data in pamphlets or brochures and give it to your patients and to your visitors, you have to validate it before you make it go public. If a change has been made to an existing measure, إذا غيرنا البسط، إذا غيرنا المقام، إذا غيرنا inclusion أو exclusion criteria for any of the KPIs, then we have to do the data validation. If the data source has been changed, على سبيل المثال، إذا إحنا بدأنا المؤشر هذا with a manual collection، بعدين المستشفى طبقت HIS, Health Information System, implemented it this month. So we're switching from manual to electronic. Whenever you do a switch from manual to electronic, please ensure that you validate the data, because that switch can create problems and you need to ensure that your KPIs are still validated. Or if the subject of the data collection has changed, which means أنا كان عندي لهذا KPI certain data collectors They could be nurses, they could be medical health record technologists, you name it, and I changed it. I changed the data collectors. So whenever I change the data collectors, I really have to do data validation, and that's very important. How to do data validation? This is a very big subject. Unfortunately, I don't have time to go through the technical methods of data validation, but I'll share with you some ideas, and I'm sure you can go back to the internet and get more information about this. One very good way to do the data validation is what we call inter-rater reliability test. This is a well-known statistical test. It's also known as the kappa value. This will give you a very easy and systematic way to validate your data. You can learn more about that test, and you can do it in your organization. Or you can do data recheck. Data recheck in a very simple way is that you have one data collector collect the data, and then you have a different person, independent, who did not collect the data with person A, go back and recollect the data, and then you compare the data from person A with the data from person B, but they have to be independent. They cannot do it together. Data recheck, that's another way of doing data validation. So that's in terms of data validation. Moving on to the other section, or المحطة اللي نقدر نقول قبل الأخيرة اللي هي data aggregation. Data aggregation أو تجميع الداتا. That's what data aggregation is. Data aggregation can be done on a daily basis, on a monthly basis, on a quarterly basis, on an annual basis. It really depends on the KPI that you're measuring. This is just an example of aggregation that happens on, we can see here, a monthly basis. Then we move to the next station, which is data analysis. تحليل البيانات. What we mean by data analysis is basically how the data will be represented visually. How will the data look visually? This is a key element of the KPI journey. And often we as quality professionals, we overlook this part. And basically what it means is, as quality professionals, we have to present the data to the leaders, to the physicians, to the allied health professionals, nurses, you name it, in a very simplified graphical display that catches the eye and that's simple and that's not too complicated. Often what we do, because we own the data and we're very passionate about it, is we make all of these complicated graphs and figures because we understand it. Keep in mind, who is your audience? مين هو المتلقي? المتلقي, most often than not, doesn't have a background in quality, doesn't have a background in data analysis, so they just need something very simple and very visual that they can look at and understand how the data is performing. Let me show you some examples. And again, these are real life examples that are taken from one of the hospitals of E1, and I'll show you multiple examples so you understand my point. This screen or this graph shows overall compliance in documentation or medical record documentation. And what you can see here, I'll choose, and it basically shows the different specialties and their compliance with medical record documentation. Let's look at cardiology here. You can see that cardiology as a specialty, they are 95% compliant with medical record documentation. They improved from the last quarter where they were 91%. Now they're at 95%. This arrow, green, going up, means that they improved. Another specialty, for example, pediatrics, going down with their compliance. So what this shows, at a glance, you can see who's doing well, okay, and who is needing to improve. You don't have to have a background in data analysis. You don't have to have a background in quality. With one image, visual display, you can see who's performing well, who's not performing well. So us as quality professionals, we really have to always think about how are we displaying our data? How are we making it very clear to the audience? Let's look at another example. This is Department X, it could be any department, and these are the different aspects of the medical or the clinical documentation, or different aspects of clinical documentation compliance. This could be any department. What I can see at a glance, and this is a pie chart, what I can see at a glance is they have a very big issue with this area. The compliance here is problematic because, again, remember, we're looking at least compliance. So here I know that the blue is the most area with the least compliance. What is it? I can very quickly read. It's very small. I'll read it for you. Education needs assessment by physicians. So at a glance, I can see that for Department X, the area of least compliance is the education needs assessment by physicians. So we know that the physicians are not compliant with documenting the patient's education needs. The second problematic area is this one right here. I can see, and it can tell me consultant signature on discharge summary. So I can see that this is an area of least compliance with this department, which is consultants signing the discharge summary, and so on and so forth. So the beauty of data analysis is that you really have to choose a very simplified way to show your data graphically. Anybody without having a background in quality or a degree in data analysis can know what's happening. So you have to have a very clear title. You have to have very clear data display and numbers. It's always helpful to have the percentage compliance and breakdowns. Clear title, clear graphs, clear colors, good graph. Let's have another example. And again, this is taken from the E1 hospitals. These are 6 hospitals of E1. I've removed their titles, obviously for anonymity purposes, but what can you see here? These, and again, are different hospitals in E1. And here, we're looking at waiting time for appointment in days. The title is very clear. Anybody can see what we're looking at. We're looking at waiting time for outpatient appointments in days. Let's look at the thresholds. Blue means world-class, very good. Green means I'm performing at an acceptable rate. Yellow means I need to improve. And red means I'm performing at an unacceptable rate. Look, without even knowing who these hospitals are, you can clearly see that hospital C and D, without knowing who they are performing at a very good rate. So they don't have a lot of waiting time for their appointments. They are performing very close to the world-class target. Good, excellent. You can also see that Hospital F, without even knowing who Hospital F is performing at a stage that needs improvement, or at a rate that needs improvement. This very easily, I can see that Hospital F is performing at a lower rate than Hospital C and D. Hospital C and D are performing better than Hospital A, for example, because immediately you can see where is the KPI, how is it performing, what is the KPI title, what are my thresholds, what are the months. These are the months of 2019, and this is the waiting time in days. The clearer, the simpler your display and your graphical display of the KPIs, the simpler you can tell the story. And again, all of you with me, you're able to look at this and you're able to see, without giving you much of a background, which hospitals are performing good and which hospitals need improvement. So this is a very good example of how you use the graphical display to your advantage. One more thing I want to say here that's very important. Mostly when you're presenting KPI performance in the terms of in graphs, you're usually going to be presenting it to hospital leaders, board members, chairmen of departments, medical directors, nursing directors, correct? These people are extremely busy. they don't have time. The time that you are given with them is extremely limited. So instead of overwhelming them with many graphs and many data, use simple graphs. This graph, in a glance, you're able to see the performance of 6 hospitals. 6 hospitals. At a glance, who's performing well, who needs improvement, you're done. Remember, your audience needs to receive the message from you in a very succinct and summarized way. Usually mean a better presentation. The less graphs, the less information, and the more concentrated the information is, usually better. Now let's come to the final station in our journey, or in our train track, if you will, which is data reporting. How often should you report your data? Data reporting frequency depends on your audience and depends on what your audience wants. Let me give you an example. Sometimes you need to report data on a daily basis because your audience wants to see that data. That KPI is critical and I need to see it on a daily basis. This is, again, a real example taken from the E1 hospitals, one of the E1 hospitals, on a daily dashboard. Why? Because the medical director in this hospital particularly wanted to see a certain set of KPIs on a daily basis. For example, number of blocked beds in the hospital, number of ICU cases pending transfer out, number of surgical procedures performed, mortality, number of mortality. The medical director needs to see this, the nursing director, the hospital CEO needs to see this on a daily basis because they're going to take action based on the KPI performance. So sometimes you need to show it on a daily basis. Most often, data reporting will have to happen on a monthly basis. And it's very good for you in your organization, in your quality departments, to decide what are the KPIs that my management want to see. Let's agree on the set of KPIs. Let's ensure that these KPIs follow the priority list, which we talked about earlier. High volume, high frequency, problem prone, Sibahi requirement, etc. And once you agree with your management on these set of KPIs, you have to produce monthly reports. And you have to present these reports to them in their management meetings, in your general staff meetings, you name it. The very important thing about data is data sharing. So it's one thing to have a very nice report, a very neat report, graphically displayed, good definitions, but if you don't share it with people, then what's the use? So always remember, once you create your data reports and your KPI reports, don't forget to share them. Share them by email, share them by WhatsApp, share them on your website, on your hospital portal. But the data is only as valuable as the extent in which you share it. Lastly, and this is the end of my slides, is sometimes you also need to share data on a cluster level or on a regional level. So remember, the data sharing or KPI reporting is important at an organization level, and it's also important to happen at a cluster level or at a region level. This is an example of the report that we in Quality Affairs produce to the cluster on a monthly basis. This is, again, it's the KPI indicator report. This is an example for the August report. And what we have in it is these KPIs. So this is a part of the KPIs that we share with the cluster leadership, with the cluster board, with the CEOs of the hospital, with the quality directors, and we ask them to share it with everybody because by that, I conclude this talk. I hope that it was of use to you. I understand that we have 15 minutes left, and I'm more than happy to answer any questions if you will have.
الله يعطيك العافية دكتورة، شكرا جزيلا، بصراحة محاضرة رائعة، الله يعطيك الصحة والعافية. كثير من الاستفسارات
ما أسمع.
He muted himself.
I can't hear.
He's on mute.
ما أسمع عبد اللطيف. I think you're on mute. It's okay.
اي دكتورة معلش بس من عندي قطع شوية.
ما عندك مشكلة بس ما سمعت.
طيب.
It's okay.
أقول لك يعني في كثير من الناس سألوا كم سؤال. It's very great بصراحة presentation for us.
Can't hear. Maybe I should do this.
معي يا دكتورة؟ أنا عندي مشكلة في الكونكشن يبدو.
I can hear you عبد اللطيف. أيوة أسمع.
كويس. لأن الكونكشن عندي شوية مو مضبوط. طيب. فالأسئلة اللي كانت جتنا الزملاء كانوا يسألون بعض الأسئلة. There is one question. They said when I did not have benchmarking like medication error. There is no international benchmarking. يعني someone would like to do a benchmarking but couldn't find another organization to do benchmarking. What should we do?
This is an excellent question. Very good question, and we are often faced with this. KPIs الحساسة اللي ما فيها international benchmark. And for example, medication error reporting or sentinel events, for example, or number of OVRs. Those KPIs are very, very difficult to have benchmarks for. But what you can do as an organization is what we call internal benchmarking. Internal benchmarking is to look at your own performance historically and start comparing with. يعني I'll give you an example with number of OVRs. It's very good for an organization to collect the number of OVRs per month and to do it on a monthly basis. Then probably, and you continue a year, right? So you do 12 data points. Let's use it for 2018. مستشفى X جمعت كل ال OVRs for 2018 on a monthly basis, and then they have an average. They know what the average is for the entire year. That will be their, what we call internal benchmark. So moving forward, they continue measuring it and comparing themselves to themselves, يعني comparing their performance to their own performance. Are we close to our yearly average? Are we below? Are we above? So that would give you a clear idea of where you're performing. So إذا ما عندك international benchmark, do internal benchmarking and use your historical data.
Excellent, دكتور. الله يعطيك العافية. طيب دكتورة، في another question. They are talking about إنه can KPI results be misleading and when?
Yes, absolutely. This is a great question. KPI results can be misleading if they're not put in a good context. Let me give you an example. Basically, a context is when you see an improvement in one area, but you have to couple it with the full picture. So, for example, let's look at emergency department KPIs. Looking at the KPI اللي هو registration to disposition, okay, will sometimes be misleading. لأنه it looks at the whole journey, right? And it's not able to tell you where the bottlenecks are exactly. So لنفرض registration to disposition is the holistic KPI, okay? But it doesn't tell me the full picture. I have to break it down into elements. يعني مثلا, if I'm doing triaging, okay? And if I'm doing really good work on triaging and the triaging process is working very well, so that means I will shorten the registration to physician, okay? So I have to take credit for the work that I'm doing in improving the triaging process. So if I only look at registration to disposition, I'm not gonna get a real picture about the triage process, اللي هو registration to seen by physician. So I have to put the big KPI, or I break it down into small KPIs. The other part is, you know, let's say I improved my internal process in the emergency department. Physicians are coming on time. They're responding to their consultation on time. Radiology is being done, or I'm getting the results back very quickly. Stat lab tests are happening and they're coming back, the results very quickly, and I'm doing very well. However, my bottleneck is from the patient, once they are diagnosed, is a waiting time from decision to disposition. The bottleneck is the inpatient bed. أنا عندي مثلاً ما عندي أسرة. The patients are being waiting in the ER, not because there's a problem in the ER process, but because they're just waiting for a bed to open. For just looking at registration to disposition, حيكون misleading. So he's absolutely right. I have to break it down into segments to give the full picture and not to mislead leadership or the ER leadership locally.
شكرا دكتورة. دكتورة في برضو سؤال very يعني so I don't know how to answer this question. Do you think even small peripheral hospital need quality professional in the present day of era of quality of healthcare? يعني they mean إنه do we have to have a trained quality healthcare professional? بصراحة أنا السؤال لو كنت dismissed بس قلت لا خلينا نجاوب لأنه it's very good to have answer such questions. الناس البليف محتاجين أحيانا إنه we change it.
This is a good question, and really what I want to say is the following. Quality and KPIs doesn't have to be complicated. People often have this misconception إنه اللي يشتغل على KPI لازم يكون عنده PhD in data science ولا master degree in XYZ. This is the farthest from the truth. The more simple you keep it and the more you start with simple steps and you increase gradually, the better. So when we talk about rural hospitals, على فكرة كل الأشياء اللي أنا I discussed today are basics. يعني when you look at length of stay, waiting time in the emergency department, OR cancellation, these are very basic KPIs. وأنا أبغى أقول نقطة مرة مهمة. الrural hospitals أو المستشفيات الطرفية عندهم advantage رائع إنه حجم العمل مرة صغير. حجم الأوبريشن جدا جدا محصور وصغير و you can control it. فبالعكس أنتوا as a rural hospital you're at a very big advantage. You have, for example, 40 beds, 50 beds. You have 15 physicians, probably 50 nurses. So if you just start with 2 KPIs for the emergency department, 2 KPIs for the inpatient, 2 KPIs for outpatient, and you have the staff to support you because the volume عندك is very low, so it's manageable. So don't take it as يعني عائق أو as a challenge إنه oh I'm in a rural hospitals أنا في مستشفى طرفي فما أقدر أطبق هذه الأمور. بالعكس أنت عندك فرصة أكبر وأروع إنك تطبق هذه المؤشرات لأن حجم العمل بالضبط لأن حجم العمل جدا جدا صغير ومحصور.
صحيح. طيب دكتورة في question يعني أكثر من question كانوا الشباب يسألوا عنه إنه the reference for KPI if we need to have a reference or number of KPI should be in department معين. Is there any fixed number that the KPI should be like this in this area in this location this وإيش الreference that we can get for KPI?
Yes.
تفضل.
Again, this is a great question. I'm very impressed with the questions today لأن صراحة كلهم right on the money.
The presentation
KPIs.
is excellent. Well, presenter is more than excellent. So the question is coming in the same بصراحة باشا. الله يوفقك يا دكتورة. Go ahead.
الله يحفظك. لا بالعكس, I'm very impressed. These are great questions. Number of KPIs. This is a very big topic that we need to address. Often hospitals, quality professionals, and hospital leaders think that the more KPIs that you have, the better. This is the farthest from the truth. And personally, I always find myself trying to stop a leadership or persuade the leadership to reduce the number of KPIs. Why? The more the number of KPIs, the more distraction. في شيء أو في concept اسمه scope creep, which means that if you focus on everything, you will focus on nothing. Okay? So ideally, in my opinion, the number of KPIs that should be monitored on a corporate level for a hospital or for a cluster or for a regional health directorate should not exceed 30. 30. Don't exceed 30. The minute you exceed 30, you will lose direction, you will lose focus. You're just going to be doing a paper exercise. 30 or less is the ideal number where you can have enough monitoring, enough opportunities for improvement, and if any of the KPIs dip, you will have an opportunity to do focus improvements and so on and so forth. والنقطة اللي أبغى أضيفها هنا مهمة إنه you will find that some KPIs with time start to perform very well. خلاص, they stabilize. يصير عندهم stabilization. Think of removing them and replacing them with different KPIs. بمعنى إنه just because we are monitoring KPI X for 2 years doesn't mean that we have to monitor KPI X for the rest of our lives. We can replace it with another KPI that is problematic. في مشاكل بحيث إنه نقدر نتابعه ونراجعه. بس عدد ال KPIs لا يتجاوز 30. هذا يعني من وجهة نظري.
أوكي. طيب دكتورة, في عندنا برضو بعض الأقسام يعني في الأسنان, مراكز الأسنان المتخصصة, قسم الأشعة, they said إنه they need to know some examples of such KPIs in their department.
Very good. I would say أنا ما راح أتكلم يعني تحديداً عن مراكز الأسنان, بس بتكلم بشكل عام عن أي قسم يبغى يبدأ ال KPI journey. Start with the basics. يعني start with the volume KPIs. How many patients are you seeing? How many new patients are you seeing? يعني how many new patients and what's your percentage of new patients عشان تعرف ال growth حقك. So those are volumes. Then you can do a little bit of quality. مثلا compliance with medication, compliance with treatment plan. That would be another good KPI. Then you move to safety. Let's look at مثلا ال rate أو ال number of patient miss. Are we doing any wrong site, wrong tooth extractions or surgeries? Are we looking at compliance with patient safety, quality, and
راح الصوت والحين رجع. اوكي طيب دكتوره، في سؤال على they said انه اذا كان can I bring external auditor to do data validation if I do not have a peer in يعني the same cluster or the same hospital?
Yeah. This is again a great question. بتكلم في تطبيق عملي لهذه المسألة في الوزارة، وهي برنامج أداء. So برنامج أداء للhospitals that are participating in, we all know it's a number of KPIs that we report on a monthly basis. And what أداء program embedded in أداء is a validation process. And how is that done? It's done through external validation. So on a monthly basis, كل مستشفى مشاركة في برنامج أداء حيجيها external validator, which is a PIO from a neighboring hospital or from a different hospital that comes in on a monthly basis and with a new set of eyes looks at their data submission, looks at their data definitions, looks at their challenges, and gives them recommendations on how to improve and how to progress. For the idea of having an external consultant is a great idea for validation. And don't think of an external consultant إنه لازم أجيب شخص خارجي أو غريب. ممكن يكون from a neighboring hospital. ممكن يكون from a neighboring region. Yeah.
صحيح. طبعا هنا الوقت داهمنا ومشى بسرعة سبحان الله العظيم، ولكن معنا آخر اللقاء بناخذ شيء جميل. أستاذة هيفا تفضلي معنا أستاذة.
يعطيك العافية أبو مشاري. شكرا دكتورة رنا. من حسن حظي لحقت على الجزء الأخير من المحاضرة. سامعيني؟
واضح الصوت واضح.
إيه، من حسن حظي لحقت عليها. محاضرة جدا مهمة صراحة وأسئلة رائعة، وشكرا لك دكتورة رنا. الحقيقة لبت الدعوة الدكتورة، يعني أنا قابلتها بكونفرنس وقلت لها ضروري تقدمين لنا ويبينار، لأن ما شاء الله دائما محاضراتها في الكونفرنسز أكثر من رائعة. فأنا بس حبيت أشكرك يا دكتورة وأشكرك عبد اللطيف. روعة إدارة الحوار والتنسيق، يعطيكم ألف عافية. شكرا لكم، شكرا للحضور.
شكرا لكم جميعا، وإن شاء الله لنا لقاء. المحاضرة مسجلة وراح ترسل لكم، السلايدات إن شاء الله تكون موجودة عندكم. أي حاجة تحتاجونها بليز لا تترددون في التواصل معنا في إدارة الجودة بالوزارة، وكذلك في التجمعات وفي المناطق وفي المستشفى. ترى كلنا تحت أمركم ورهن إشارتكم.
شكرا لكم جميعا، ولي الشرف إني أشارك اليوم.
اطلبونا تجربة. محاضرة جميلة جدا جدا جدا، ونالت إعجاب الكثير من الحضور وهم متواصلين معنا حتى الآن. شكرا لك يا دكتور. الله يعطيك العافية.
شكرا عبد اللطيف.
نراكم على خير إن شاء الله.
الله يحفظك. شكرا.